This is something that worries a lot of people. And of course it should. It's in every movie. You're at the grocery store, just walking down the aisle to get your pickles, and suddenly your water breaks. What do you do if your water breaks while you are in public? Today, I'm going to share with you what to do and some facts around water breaking that may help you feel a little bit better. And I got to tell you, after seeing tons of people whose water broke before coming to the hospital, I have a wide variety of experience to talk to. So I'm so glad that you guys are here because I know it's a concern for a lot of people. First off, I want to go through the facts. One of the biggest ones that you need to know is that about only 15% of people's water breaks before they get to the hospital, which means most people's water is breaking with us in the hospital. And I actually have a whole post about choices to make during labor that includes if they're going to break your water. I'm going to link that one down below for you. And in me just talking with lots of people whose water broke, most people's water breaks while they're in bed, which means you need to make sure that you have a waterproof mattress pad, or while they're on the toilet, or getting from bed to the toilet. A lot of times people will feel a pop in bed and then they stand up and they start to feel a gush of fluid. I have actually talked to very few people whose water breaks like it does in the movies. And while we're here, please do not use media like movies or even social media to get prepared for your upcoming birth. Make sure that you're taking a high quality birth class. If you're looking for one that's easy to put into your schedule and easy on the budget, I'm going to link the one that I recommend down below. And another thing is a lot of you are looking at like a tsunami wave that comes out, but in reality, most people don't have a ton of fluid come out. They might get a little gush, then they go to the restroom, and then more comes out as they relax on the toilet. So I'm here to tell you that your chance of a huge gush of water coming out and embarrassing you while you're in public is really, really low. However, I'm the girl that still wants to prepare for it. So how do you get prepared just in case your water does break while you're out in public? And really quick, this whole video comes from a post on my website. I'm going to link that post down below if you want more info. The first thing is in your last few weeks of pregnancy, most people are wearing a pad all of the time. Your discharge really changes, which I know you're like, ooh, Hillary, please don't talk about that. But I'm here to give you the facts and what you really need to know. But there's so many discharge changes that happens down there. It can get kind of confusing if your water broke or just like what's happening down there. So most people are wearing a pad, and I actually recommend that you wear a pad those last few weeks of pregnancy because it can catch a lot of this issue and then you can make it to the restroom. I also recommend that people have some towels both in their car and at work if that's an option for you with how you work, like in your locker if I was a labor and delivery nurse, although we have plenty of things to suck up fluids as a nurse. I wouldn't be as concerned. Another thing you can get is something called chucks. That's what we call it in the hospital. Most people call them puppy pads, but they're just absorbent pads that you can, put on your office chair if you want, just in case this were to happen. And they are super handy to have at home either way when you have kids. Sick kids, a spit up baby, just protects the old furniture. Huge fan of chucks, both as a nurse and as a mom. And if you're like, what the heck are chucks? I'm going to put a link down below that you guys can figure out what they are. The next thing is to have a plan. I actually have so many teachers talking to me about this on social media. And I think their big concern is they'll have a big contraction and they're in a room full of children and they don't want to freak them out. They want to make sure that they're safe because God bless all the teachers out there. I totally understand you. But I think it's really important to have a conversation with your administration or your manager team about what you are supposed to do, especially in a situation where you're alone with other people, if you have an emergency during your pregnancy. It could be your water breaking, you start to bleed, things like that. Great conversation to have. Most of you're going to call the office, right? You know what to do in case you have an emergency, but having that conversation with your team and telling your principal that this is something you're concerned about, a lot of times just having that plan in place can help you feel a whole lot better. And I actually have a whole post on when you should go on maternity leave. I'm going to link that one down below as well. Okay, so your water broke. What do you do? I don't want to leave you hanging on that part. The first thing you need to do is actually make sure that nothing else came out. This includes an arm, a foot, or a cord. Now, this is extremely unlikely, but if it were to happen, it can be an emergency. You need to get your bum up in the air like puppy pose in yoga and call 911. Again, really rare. If you have any questions, you can do a finger sweep with your finger, but most often if either of those came out, it will be really apparent right after your water broke. So again, if those things happen, not something to be scared of, but call 911 and get your butt up in the air. You want your uterus to be much higher than your head. And this one involves tacos. No, we are not going out to eat. It's the acronym TACO. T stands for time. You just want to note like the time. We don't need seconds, quarter past the hour, something like that. Or even just the hour is completely fine. A stands for amount. Was it a huge gush of fluid? Less likely. Or a little bit came out. C is for color. Was it clear? Was it brown? What did things look like? O is for odor. Could you smell anything of it? If you can smell something from the amniotic fluid, if your amniotic fluid has an odor, it's going to be really obvious. So you don't need to like get in there. You'll be able to tell if there's an odor. Okay, once you've got your taco down, you're going to want to call your provider. You do the taco because those are the things that they're going to want to know. And it is a great time to touch base with them. Now, most people feel like if your water breaks, you need to head right into the hospital because that's what the movies often do. Most people whose water broke, it is a sign that they are in labor. So if contractions intensify and you feel like I need to go to the hospital right now, then head on into the hospital. But if you're kind of left wondering what should I be doing, it is fine to go ahead and contact your provider. Most providers have someone on for them 24/7 that can answer these types of questions for them. So give them a call so that they can go over what's important for you and your circumstances, including your prenatal history, your past OBGYN history, and kind of how far away you are from the hospital, anything else that's going on so that you guys can make a plan for yourself. I know everybody likes to boil when you should go into the hospital into a magical formula, but there really isn't one of those. It really depends on each person and each person's circumstances. Editor Hillary here to say it is also super important that once your water breaks, you're still assessing fetal movement. Make sure baby's still moving, watch fetal movement. And if you're at home, waiting for labor to start, you're still going to want to be doing your kick counts and things like that. Fetal movement still very important. I am also here to say that sometimes laboring at home in early labor can feel a little bit scary. If you're here watching me here at the Pregnancy Nurse, there's a good chance that you're going to plan on delivering your baby at the hospital. And so you really haven't planned on how to labor on your own in early labor, even though that is the safest place for you to get those juices going so that you can move into active labor. So I recommend a birth class that has a section on what to do in early labor, how to let labor progress, how to get the rest and the nutrients that you need during that important time. The birth class I recommend does have that. I'm going to link it down below. The final thing you're going to want to do is to watch for a fever. The arch nemesis of your water breaking is that bacteria could come up to the baby and your womb and start an infection with that dark, moist environment where bacteria loves to grow. So in the hospital, we check your temperature every hour. Most likely, if your water is broken, your provider is going to encourage you to check your temperature at home. Everyone should have a thermometer when they're bringing baby home. So now is a great time to get a good axillary thermometer. I'll link a thermometer that's easy to use down below for you guys. You don't need anything fancy. And I really like the armpit thermometers way better than the forehead kind. I think they're just more accurate. Now here's the big question. Do you need to run right into the hospital? Like I said before, that always happens in the movies, but your best place may be laboring at home. Studies have shown that most people go into labor within 24 to 48 hours of their water breaking, and sometimes that needs a little help from the hospital, but most often it's something that you can start on your own, and most people are most comfortable and safest in their own home rather than coming to the hospital, where we may encourage you to take medication that'll encourage things along, and you may not want that. So talk with your provider to make the best choice for you. I am here to tell you that this can be really confusing, but so can labor. I mean, you just don't know if it's like a small trickle of fluid or has your discharge changed, and you're just not prepared for all these different things because people don't talk about them. That's why you need to get prepared with an expert. I'm so glad that you're here watching me, but come join me in the online prenatal class for couples where we get you prepared for all of birth. I think it's really going to help you out. Now, you might be wondering what the heck makes your water break. I have a whole video about that. I'm going to link it up above, but hopefully this post answered your questions. You need to know that it is not very likely that it's going to break or be a big deal in public. You want to make sure that nothing else has come out, and you should touch base with your provider, but you may not need to go right into the hospital when your water has broken. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.